Good evening, viewers. Welcome to your favorite medical show, Ask Dr. Sawh. We're coming to you live from TBN Studios. We want to apologize for last week's early start. Mishap with a little bit of the schedule, but we're back and we have your questions from last. Actually, we have one question from last week that we're going to be that I'm going to be asking Dr. Sawh on behalf of you. Remember to continue to send in your questions, and next week we are going to answer those questions, whether they are related to tonight's topic or anything that you want to talk about in the medical field. Joining us this evening, as usual, is Dr. Sawh, and he's out in England. Good evening, Dr. Sawh, and welcome to your show.
Thank you, Dr. Sawh. Good evening to you and the viewers. Thanks again for having me.
Brilliant. Dr. Sawh, this evening, the topic is fatty liver disease. So I want to share with a fun fact that when you told me this was going to be the topic, I started doing some research, and one fun fact I learned is that the liver is the second largest organ of the human body. The only other organ that is larger than that is the skin. And I learned that the liver does some amazing things. It even has the ability to regenerate itself. So tonight we're not just speaking about an organ, but we're speaking about a super organ here, because that's what the liver seems to be. So we're talking about fatty liver disease, and I want to know a little bit about fatty liver disease. So if I may, Doc, I want to start with the first question and ask you, what is fatty liver? And remind us a bit again from when we spoke about this a couple of times, why the liver is important and what are some of the functions, some of the main functions of the liver, if not all.
Fantastic. Yeah, no, indeed. I think the liver, as you say, it's a big organ. It is, I like your term earlier, when you talk about the engine house.
Yes,
so
yes.
When we talk about the abdomen, it's the engine house. The liver is in the abdomen, so it's like a main organ in the engine house. So the liver is very, very important. I'll go through the functions so we will understand why fatty liver is important. So your question, by definition, fatty liver is the accumulation of fat in the liver cells. So as you know, our cells, you have the cells, and whatever function the cell is doing, if there is something that enters the cell, it can disrupt the function. And if too much fat gets into the liver cells, it will disrupt the function. So by understanding the function now, we will know what are the consequences of fatty liver. So the liver, let's start with main function. The functions of the liver, main function, metabolism. What is metabolism? The liver, the food we eat, protein, carbohydrate, fats, it gets into our intestine, our stomach, it gets digested, it then enters the bloodstream. From there, it is transported to the liver, and the liver metabolizes, that is, process the food. Now, it stores sugar in the form of glycogen, and also when your body needs sugar, the liver can break down the sugar to provide energy for the body. So it processes that. It processes the fat, the protein, and the carbohydrates. So we call that the metabolic function of the liver. Then the liver works as an excretory organ. It excretes in that processing. You have waste products that are formed, and the liver excretes it. Ammonia, for instance. Also, if the body has got toxins, so you can get toxins from medication, you can get toxins from whatever the reason is, the liver excretes and processes that, and it excretes it. So we can say the liver detoxifies the body. The liver also, it makes protein, and it works in a way where it makes clotting factors. So there are some for blood to stay in its current state, or if we have a cut and you have formation of a clot to prevent bleeding, the liver is responsible also to make some of those protein that are responsible for clotting. So if your liver fails, you would find that patients can have bleeding disorder as well. The liver it produces protein to also maintain the pressure in our system, our blood pressure. So if you don't have enough protein in the blood, in the vessels, it will seep away. The fluid seeps out of the blood vessel. So the liver created something called an oncotic pressure, we call it, where the protein that is from the liver gets into the bloodstream and it maintains our blood pressure. So that's an important function. A lot of people, they didn't know that.
I didn't know
What else?
that.
Bile. It produces bile. Bile, of course, we talked about gallbladder disease the last time. Bile is responsible for digestion of fatty acids and fats generally. The liver also, it works as an immune, it has an immune function where it helps the body to fight germs. So the liver itself has got cells that help with our immunity. And also things like it stores vitamins, iron, vitamin B12, micronutrients. It works as a storage. What else? Hormones. It helps in metabolizing our hormones, which controls, the equilibrium of the body. So it has a massive role, massive function. So when we talk about fatty liver, which eventually can cause disruption of those functions, you know now what are the implications of that. So we want to pick it up early, we want to treat it. Why do we want to treat fatty liver? Fatty liver eventually, it goes on to cause inflammation of the liver, which we call hepatitis. So we talked last week about inflammation of the liver as a result of viruses. Also, fatty liver can cause inflammation. So that I decided that this is a separate subject. Let's talk about inflammation as a result of fatty liver. And as you get constant inflammation, as you say, the liver regenerates, it regenerates. So what happened? It forms fibrous tissue and then cirrhosis. So you have fatty liver. So the natural evolution would be fatty liver, inflammation called hepatitis, fibrosis, where it starts getting knotty, sort of, and cirrhosis, where it's stiff and hard and nodular. Now, when you reach that level, we're talking about liver failure. It means the liver stopped working, and the only thing that will probably help you in the long term is really a liver transplant, a new liver.
And when the liver goes down,
very hard to get.
Yeah, and when the liver starts to go, everything starts to follow one by one. I've seen it, man. I've witnessed this firsthand with someone who's very close to me. But before I ask you the next question, you're explaining all this, and I can't help but think how amazing this human body is, how amazingly complex, but yet so, man, everything works with so much precision and everything works. Yeah, it's amazing, and we really need to take care of our bodies. And that is one of the reasons we have these shows, Doc, so that people, will be more health conscious. Of
course, we are more aware of our health. And now with all the information on the internet, sometimes it's difficult. I get patients coming all the time and they say, Doc, I've read so much about this, but really, actually, I don't understand any of it. Can you just break it down? And I think the intention of our program is really to break it down in small bits where patients can understand. And I would love feedback, and yourself, I would imagine, if people can tell us, the viewers, if they understand it, if the language is too scientific, then fine, we'll break it down a little bit more. And also if our pace is good enough, or I'm being accused of speaking too fast.
No, Guyanese people generally speak fast, so that's all right.
So sometimes, patients come and say, Doc, slow down, let us take this slowly. So I really want to spend time to say it slowly, and in bits and bytes that people can understand.
Right, and remember, you, the viewers, also have the opportunity to send in your questions. Send them in right now, and next week we will answer those questions. So, Doc, I want to ask you this. What is fatty liver then?
Yeah, so it is the accumulation of fat in the liver, which causes eventually, over time, it causes disruption of the liver function.
And what causes this fatty? What causes fatty liver?
So there are many causes for fatty liver. We can break it down into what we call alcoholic liver disease. So alcohol is a very big cause. As a matter of fact, it is one of the commonest causes in some parts of the world, and in some groups of patients where you have alcoholic liver disease is a big cause. And then you have the non-alcoholic fatty liver, which you get as a result of actually accumulation of fat from either obesity. So if you're obese, if you have a metabolic problem where the liver produces more like cholesterol, high cholesterol or high triglycerides, so fatty bits into the blood. It gets accumulated. It causes fatty liver. Diabetes is a big cause, so diabetes can cause fatty liver. There are other causes, for instance, people who overeat and undereat, so starvation. So when you starve, your body breaking down fats, and that can also increase fatty deposits in the liver. So starvation by itself can also cause it. There are certain drugs like methotrexate, tamoxifen, amiodarone. There are some drugs that can also cause fatty liver. What else? There are some people who are born with metabolic disorder where their body can't process enzymes deficiency, so we call them glycogen storage disorder. It can give rise to fatty liver. And then you have fatty liver associated with infection like hepatitis C associated fatty liver. So there are many causes, but by far the commonest cause is, I would say, in terms of chronic liver disease, would be your alcoholic fatty liver, your non-alcoholic fatty liver, and your hepatitis as an infection of the liver. Those are the three common causes that actually accounts for majority of the chronic liver disease, which would then lead on. So the natural history is that you have fatty liver first, then it goes on to have inflammation and cirrhosis, and that's your and liver failure, which is your end stage liver disease.
Wow. How do you know that you have fatty liver disease? Or are there telltale signs? Are there symptoms? Let's say I'm a type of guy who I'm listening to the show and I know to myself I've been taking a lot of alcohol in my system. Are there tests that can be done to determine whether you have this?
Definitely, absolutely, there are tests that can be done. But let me just make a point.
Yes.
We can assume, I can say blindly, 90% of people who drink too much alcohol, they've got fatty liver.
Okay.
And that's accurate. That's the data.
Wow, 90%.
So 90%, 90 to 100%.
Jeez.
People who drink excessive alcohol. So what we consider excessive for fatty liver, they say if you drink more than, for a woman, 20 grams of alcohol per day, which is about 2.5 units. So like half a pint of beer is a unit, or a short is a unit.
Yeah.
So if you drink more than 2.5, that for a woman, that gives rise to fatty liver. Or a man, 30 grams, which is like 3.75 units. So I can say, without doing any tests, if I say 90 to 100%, and you tell me, hey, doc, I've been drinking, how much you drinking? Oh, I'm drinking 5 pints a day.
That's
I said, definitely you have got fatty liver. Yeah. So the thing is, most patients with fatty liver, they don't have symptoms. So you're not going to feel anything with just a fatty liver. We normally pick that up incidentally. So you may have gone to your doctor for a health screen or a blood test. So you'll go there and you'll have a scan. Let's say you have a scan for something else, it shows fatty liver. Or you have a blood test for something else, and it shows that your liver enzymes are elevated.
Okay.
Now, however, to be sure that this is fatty liver, really an ultrasound is what is needed. Because you can have, I can say, about 3/4 or 80% of the people who have got obesity have got fatty liver. 90% who drink too much have got fatty liver. So those are the stats or the data we have. But also, if we find that your liver enzymes are elevated, the most common cause for abnormal liver function, so when we do kidney function, liver function, you have an abnormal liver function, the most common cause would be fatty liver, be it alcohol or non-alcoholic fatty liver. Wow. Now, I mean, there are other tests now, so there are other signs and symptoms. So that when you have fatty liver, as I say, as it gets worse, so you continue insulting the liver, that is drinking or obesity or whatever it is, then you may start having symptoms where you then have inflammation of the liver. And in those cases, you will have things like you lose appetite. So we say anorexia, weight loss, you're fatigued, you're tired, you may feel nauseous, you may vomit. What else? You may have pain in where the liver is, the right upper quadrant, so the upper part of the abdomen on the right side. You may have pains there as inflammation of the liver. You may have an enlarged liver. Now, as it gets worse now, and then you have cirrhosis, of course, that's a different ballgame. That is when you start having severe liver disease where you're going into the liver failure. So with cirrhosis, your eyes start to get yellow. You lose muscle, so you get wasting, we call it. You may have your breast, you have what we call gynecomastia, so male would start growing boobs.
Okay.
And then you have fluid retention. Your tummy start to get swollen because there is fluid building up in the stomach, in the abdomen. So you have ascites, we call that. And then the blood vessel. So in your port, there's a big blood vessel that goes to the liver. It's called the portal vein. That gets, the pressure builds up because the liver is not functioning well.
Right.
It's got cirrhosis. And when that happens, you tend to have what we call collateral, extra blood. The blood is trying to divert elsewhere. And you have like varicose veins.
Varicose, so, yes. I've seen it, man. I've seen the thing.
Yes, absolutely. In your abdomen, you'll see the varicose veins in the abdomen. And then...
Doc, Justin, let's just say this here. Let me tell you what I saw. Sometimes the person would be, when he shows up, it's a whole basin of blood. Yes, black, dark,
I have
clotted.
Witnessed,
yes, I've seen this from the varicose.
A patient bleeding to death just in front of my eyes, and there's nothing you could do. You're resuscitating. You're giving all the fluid by the time you order blood, and everything else. The patient just vomiting, and I remember one time in the same surgical ward, Joshua Hospital. Patient just started vomiting profusely and just collapsed, going to shock and died. So it is dramatic because you have varicose veins now in your stomach, in the esophagus.
That's right.
And so these varices, we call them, they burst and you start to bleed. Now you can't control that. How can you? You're not seeing it. The bleeding is happening in your stomach. So as it fills up, you're vomiting the blood. Yes, in other parts we can put. In advanced centers, you can get a camera in as fast as possible. Of course, if views are obstructed, we put a tube sometime in your stomach to like a balloon to compress.
Okay.
In your esophagus, so it squeezes the blood vessel. So there are things that can be done, but the point is, it's very, very dramatic when it happens. So those are your telltale signs as it progresses from fatty liver to cirrhosis. And of course, end stage is fatal if you don't deal with it, because most end stage liver disease, you'll die eventually. And of course, if you don't have a transplant, then the transplant would be the only solution in terms of, getting back the liver. But those are your signs and symptoms.
All the signs and symptoms that you mentioned there, including the finality including fatality.
Being fatal.
I experienced that, and I would say this. It was my father.
Oh no!
Yes, I witnessed it. I witnessed it throughout, and then every one of that you mentioned there, I can recall all of them because I was there with him many times at the hospital. But so I understand what you're saying, and I understand the severity of this. And here's the funny thing is, my father was never a drinker. He wasn't a drinker. He was a pandit, right? He wasn't drinking, but there were some other issues. But let's get back to the topic here. Is to say, can we tell if somebody has? Okay, let's say somebody has been drinking a lot, right? They come in, they ain't telling that they're drinking, they tell you no drink, man, and so on. They say, man, that can get a little thing, and so. And you do a test on them, and you find they got fatty liver. Can you determine whether it's non-alcoholic or alcoholic?
Yes, correct. I mean, of course, they say there's always a story that when you ask a man how much he drinks, you have to multiply by 2. And when you ask his wife how much he drinks, you got to divide by 2. So, of course, most of the time we don't tell the truth. We don't say, right, I'm taking, half a bottle a day. I'll say quarter bottle or whatever. So, we always underestimate what we are doing. But there are tests. I mean, just to stick a pin, lots of people associate liver failure to alcohol liver disease. So what I'm talking about here is non-alcoholic liver disease. Majority of causes of liver disease, as in patients going on to have cirrhosis, actually, in some parts of the world, is non-alcohol related. It's fatty liver. So these are your obese patients, your diabetic patient. They develop fatty liver. It gets worse. Of course, alcohol compound the problem, but even patients who are not drinking, they can go on to have liver failure, liver disease, cirrhosis, and failure. But of course, coming back to that question, yes, there are tests. Some patients will come and tell you, no, doc, I'm not drinking. Well, no, I can run a test and know if you're drinking for sure. So there are some markers in the blood. So if I do a test and I see your liver enzymes are high, so the liver has got markers, it could be for other reasons. So you could have fatty liver that cause the enzyme to go high. But there is actually a ratio of 2 enzymes we look at, and we said this is more likely to be alcohol related. There's another part of the enzyme another type of enzyme called GGT, gamma GGT. That can also also be elevated. And there's another test called what's called carbohydrate deficient transferrin. So it's a protein in the blood that transport iron, and it has a carbohydrate, a sugar attached to it.
Okay.
And you have a deficiency, so it's got less sugar attached to it. When that CDT, carbohydrate deficient transferrin level high, we know that's an alcoholic. So there are blood tests that you can do, and then also your blood cell, this is called MCV, mean cell volume. The size of the blood cell increases.
Okay.
So there are markers, so we can tell, a patient can deny. So I do that. When I do medical for some patients who are alcoholic, they get the license. If the police breathalyze them and they are found to be under the influence, sometimes for the license officer to reissue their license, they want a report from me to say, Doc, can you assess this patient to see if they've stopped drinking or they've been drinking? So I will run a panel of tests and I can determine if they're still drinking or not.
Yeah. And I guess there are certain standards and that you have to follow. Nobody can come and say, Doc, man, take off 2 beers for me, no, man.
Everything is objective and it should be very professionally done.
That's right. I agree with you. So I want to ask you, though, as we got about 10 minutes more, I want to ask you, how do you manage fatty liver?
So I'll come to the management in a couple of minutes.
Okay.
But let me just stick a couple of, going back to the investigations where we say we can do tests. But just to be specific on fatty liver, the tests of choice would be an ultrasound scan for fatty liver. So that will show you fatty liver, because your enzymes and all your bloods can be abnormal for other reasons, inflammation of liver for infection or whatever it is. But fatty liver, you'll scan it, you'll see fat in the liver. So that's your test. You can also do a liver biopsy. You take a sample of the liver, you can see that. You can also do MRI or CT scan of the liver. I'm just going through some of the tests that you can do. And then once the liver becomes fatty and then it goes on to form fibrosis and cirrhosis, you can also there are special tests for that. There is something called a fibroscan, where it looks how stiff the liver is. So we send patients for fibroscan, and those are once I establish you've got fatty liver, I'll tell you stop drinking or stop doing, lose some weight and all of that. But if you don't do that, sometimes you need for me to confirm to you that, hey, your liver is getting worse, it's getting fibrosis, it's going on to cirrhosis. So then I will send patients to have all those other tests done. But coming to the management quick, because of time constraints, let us talk on that.
We got some time,
So the management, I start with lifestyle management. Anything.
Absolutely.
As a matter of fact, there isn't, for fatty liver, lifestyle is the hallmark of it. Because we know that our alcoholic fatty liver, stop the alcohol, you can reverse the fatty liver. Simple as that. So we will say, this is as a result of alcohol. How do we manage that? I will stop alcohol, then I'll go on a lifestyle modification. For the non-alcoholic fatty liver, we said obesity, high diabetes, high triglyceride, high fat in the diet, all of that contribute to fatty liver. So I will start with dietary factors.
Okay.
You want to diet and exercise, the hallmark. everyone, we would say Mediterranean diet. We say you should exercise 150 minutes a week, at least, minimum. You want your portion size. We'll send you to a dietitian to look at your diet. So you cut down your carbohydrates, you cut down your fatty food, and you go on regular exercise. You cut down on your alcohol. So those are all things that will make it worse. For patients who are obese, of course, obesity management by itself helps fatty liver. So if you are fat and you say, all right, my fatty liver is because I'm obese. So nowadays, the drugs that we use for obesity, all these Mounjaro, Ozempic.
Yes.
They're actually used. There are evidence telling us it helps fatty liver too.
Okay.
As a matter of fact, diabetic drug now, they're all being, it's being shown that the diabetic drugs, as a matter of fact, the drug that I tend to use sometimes is a drug called pioglitazone. It's a diabetic drug that is used for fatty liver.
Okay.
So, so you have your lifestyle, and also bariatric surgery. So you can have a stomach, stapling of the stomach, or, whatever bariatric surgery, shrinkage of the stomach. They can improve fatty liver conditions. So again, just to emphasize, diet. So you have diet and exercise, cut down alcohol, and then of course medication. Then you go on to your medication.
Right. Yeah. So good. So well let's tell us a little bit about medication. But one of the things that I have to ask about also, do you recommend a horrible treatment? And I'll say this: that the liver has to flush a lot of toxins. And sometimes the horrible treatment that we're using got a lot of toxins. I know this for a fact. So what is the treatment?
The current evidence by all the bodies, like the Gastroenterology Society of the US, in Europe, they would not recommend horrible treatment generally. And the evidence, there are some studies that have shown some data, but which cannot be replicated, nor do we understand long-term data on if these things are helpful. So if we talk about horrible treatment, what are we talking about? I know milk thistle. Have you heard of milk thistle, that it detoxifies the liver? It's a plant.
Yeah, okay.
You've never heard of that?
Maybe, I'm not sure, yeah.
Silimarin or something like that, they call it.
Okay.
But they call it milk thistle. So patients sometimes ask me, Doc, is milk thistle good? There are some studies that have shown that it may help fatty liver. However, there is not enough robust evidence that it is recommended. We don't have that. There are things like turmeric, curcumin, turmeric that is used for cooking.
Curcumin is jeera, we call it jeera.
No, dye.
No, I said turmeric is dye. Cumin is jeera.
Is it?
Yes, you're saying cumin is cumin. Yes, cumin is jeera also, right?
All right.
Yes.
Well, curcumin. They call it curcumin, which is like a turmeric family.
Right. Okay. Oh, that one. Yes.
So they're saying that can also detoxify the liver. But none of these things, they are all horrible stuff that people would use, but none of the medical authorities have, recommended it or would say they are good to be used and we should use it. No, there are small studies that have shown some benefit, but we don't have enough data to say, hey, this is safe and you can use it long term. There are things like polyphenols in wines and grapes and berries. They're good. They have antioxidant properties. So we are saying food that are rich in antioxidants, they can also help fatty liver. Supplements like vitamin E. Sometimes there was a study done where they have shown give patients statin, they give them vitamin C and vitamin E, and it has shown to help fatty liver. But none of these data that we have would be, we can replicate or we can say, hey, this is the current medical advice. We don't know that. There's still current medical advice. It's nothing horrible. The current medical advice would be straight to your diet and exercise and your weight loss program. And then off-label drugs, we can give some. There's some drugs now approved in the U.S. There's a drug called resmetirom, approved by the FDA for fatty liver. And then, of course, we give off-label drugs like pioglitazone and vitamin E. You can give as well. And the newer diabetic drugs, all these Manjaro and Ozempic and SGLT2 family of diabetic drugs, it is shown it makes you lose weight, and of course it helps.
Oh, thank you so much for that, Doc. We have one question from last week, and that question was if cockroaches can cause hepatitis. I'm glad for myself because I can't eat cockroach, partner. I would hold the largest anaconda running in a trench or swimming in a trench, but cockroach, I'm gone. I'm sorry. So can they cause hepatitis?
Okay. The answer to that, in briefly, would be how long more we have?
We got about 3 minutes. Yes.
Okay. The answer to that would be no, as far as I know. Right. So, however, let me just add a pin here. The hepatitis viruses we talk about, A, B, C, D, E, we know that roaches don't really spread them, However, there are other viruses that can attack the liver. There are certain things like mosquito can spread, dengue can attack the liver, yellow fever can attack the liver, and they can spread by mosquitoes. But roaches, generally, I don't know of any evidence to say that hepatitis viruses are transmitted like a vector as a result of from roaches. I don't have that evidence. I don't know of that.
All right.
So the answer to that would be no.
All right, thanks,
but
Doc.
Of course, they can transmit other infections.
Indeed. Man, I tell you, cockroaches, them like dragons when they start to fly. I can't. Viewers, thank you so much for joining us this evening. I hope you've been sending your questions. You still have an opportunity to send in a question even when the show, if you watch back this show at any given time, you can still send in your questions. Dr. Sawh, what would you like to say in closing?
Thanks again, Akash.
Come on.
Yeah, I think we're doing well. I tried to cut the program down to half an hour, so at least, it's more palatable for viewers in the sense, it doesn't take up a lot of time. And I would like to have some feedback as to if we're doing it the right way or if we can tweak it in any way whatsoever. And again, thanks to you and your team for doing a wonderful job.
Indeed. And yes, viewers, we value your feedback and your questions. And without you, this show would not even be possible. We thank you every Tuesday evening for coming out here and being with us. So thank you, and everyone stay healthy.
Thank you. Good night.